Hi, everyone, again. Okay, so we have Dr. James Schaller on the line from Naples, Florida, and we are now going to shift our conversation and topic of discussion to Lyme and Bartonella rage. So, Dr. Schaller, we would like to hear from you about what does Lyme and Bartonella rage mean? Can you have Lyme rage separately or Bartonella rage separately, or are they a combination of infections in the brain that cause this behavior? How does it manifest? Why do people get this? What does it look like? And then we'll have some other questions stemming off.
Well, let me cover those 12 you just gave. You can have just Lyme and you can have just Bartonella. My opinion is Bartonella is going to blow Lyme out of the water, but that's going to take quite a long time. The thing about them both is Lyme drills into tissue and it's always in the brain in a fairly short time. And it's harder to kill than syphilis, but related to syphilis. So just imagine syphilis or this drilling aggressive bacteria in your brain, and it's going to change your personality. And Bartonella is on the red blood cells or a little bit inside. It's on the walls of the blood vessels. It's in the lymphatic tubes. So the bottom line is they're definitely getting in there into the brain, and they are definitely changing behavior. I don't know what percentage of psychiatric patients or jailed people or divorcing people or battering people have Bartonella, Lyme, or both. And I see both an awful lot. So the idea of it's just Lyme or just Bartonella, I'm not seeing that, although I know it exists. The thing that I've said to some people is, do you want to divorce an infection or do you want to divorce that person? Because after treatment, people really do return to themselves. I may have someone that's putting knives in the wall, and I don't trivialize knives in the wall. That's crazy. But after treatment, they're dumbfounded that they ever did that. And they didn't do it the 20, 30, 40 years prior to that, never. So if the deacon at your church, and I'm making this up, but not really, is punching the walls and throwing TVs, is it alarming? It's very alarming. Am I calm about it? Never. And I do intervene quickly and treat it, because one thing that you need with both Lyme and Bartonella rage is you need to calm the brain down. And there's a number of ways to do that. A lot of people say antidepressants will do it. They usually do not do it. No matter what they say, they're wrong. They don't calm rage. Now, certainly if you're depressed, and Lyme and Bartonella can make you depressed along with every single other psychiatric problem, sure, they may help. Gabapentin may help a little bit, but often benzodiazepines like Klonopin or Ativan or Valium, they may be required just to allow somebody to sleep. That's one of the first questions I ask somebody with Bartonella. How are you sleeping? Well, it's usually not particularly well. So you fix that, and that lowers hostility. And then at times we do use antipsychotic drugs because all drugs are made for one reason. And then a few years later, they're used for 5 reasons. And then a few years after that, they have 10, 15 uses. So I do use liberally antipsychotics with people with Lyme and Bartonella rage, not to hurt them and not to get them addicted or anything silly like that. They need it to do their job. They need it to be a reasonable spouse and a reasonable parent, because the first thing you do always is you comfort and you control. You stop the pain, you stop the insomnia, you stop the rage, and slowly 1% a week, you lower the infection. So this kind of rage has to be addressed immediately. It's an emergency. It's as if the person said, I'm going to kill myself right now. I have the gun and I'm not kidding. So my concern is psychiatrists and other therapists are not familiar with this as a cause, do routine blood testing, which is usually 4 or 5 tubes of blood, which is only useful at determining organ failure. I do about 80 tubes of blood, and we find quite a number of things. But we also test for these things, and we find them, and then we target treatment to them. And one final thing on this rage issue, you don't want to get too aggressive with the treatment. You want to lower it slowly but surely, and use the Band-Aid to lower it quite a bit at first. But in terms of killing the underlying infections, let's say the average person would have both Lyme and Bartonella, which have different treatments. You want to lower that slowly because you don't want a raging Herxheimer where the infection's blowing up, creating all this debris in the body and making them more reactive again. They've already done enough damage. My opinion is there are a lot of people in jail with Lyme and Bartonella. There are a lot of people at the divorce court with the same thing. And there are a lot of people in trouble with the law with this stuff. We don't know. And the studies that are out there, they're not entirely clear to me, even though I've discussed them with experts.
We have an area here in Boston, we call it, unfortunately, sadly, it's called Methadone Mile. It's near one of the major hospitals. A lot of homeless people who have historically been on drugs. There's a methadone clinic nearby and they sleep on the streets. There's a homeless shelter there, and it's a little bit problematic for the city. There's a lot of police surveillance. You can see people shooting up on the side of the street, people engaging in very violent fights, fist fights, mostly males, but there are some women there homeless on the streets. And I often wonder when I drive by, well, these people are sleeping on the streets of Boston in the grass, in little tents or what have you. How many of these people have actually been bitten by fleas and ticks? Bed bugs.
There's no question Bartonella is highly represented in homeless people. That's not controversial. I think you're dead right.
And I just wonder to myself, these poor people, if they could only get a proper diagnosis, they could keep themselves out of trouble, out of jail, out of self-medicating their pains, their depression, their whatever symptom they're experiencing that's causing this unfortunate quality of life that they're living. And I would like to, somehow work on that in the future with our criminal justice system in some capacity, rather than sending people off to jail, wow, well, why don't we run a Lyme and co-infections panel on them first to see if there's some kind of underlying cause why they threw a chair through the window, when this kind of behavior is not really the norm for them. They're not these types of violent individuals, but for whatever reason, something triggered them, as you've already noted, and they may put a knife in the wall or knock a picture up, something triggers them. But it's all due to these infections in the brain. So Lyme and Bartonella rage, I've seen it firsthand. I've seen very violent behavior, paranoid, schizophrenic behavior, extreme paranoid behavior, to the point where the person thinks people are following them. They're setting up video cameras. I mean, it's like insane. They turn against all their previous friends. They were once at a very prominent position and then they went homeless. I mean, it's almost like a complete personality change. It's a totally different person. I've seen violent abuse between couples, where one may become very physically violent with the other, which is completely out of character. And it doesn't necessarily mean the person had any intentions of doing that. They're actually very remorseful after the fact, but it's almost like something overcame them and they said, geez, I really had no control over that. It just kind of came over me and I just snapped or what have you. But the positive note that I want to leave the audience is based off of what you said. You said that this can be treated effectively with the proper medications, and the person can return to, hopefully, a healthy state of mind with the right mental health mindset, a calm personality, a functioning personality in society. They're no longer kind of a threat to anyone, themselves or otherwise. But with proper treatment, they can be helped effectively. Is that what you've stated?
Yeah, I would agree with that absolutely. I think people are doing very well with the Bartonella treatment. There's a number of treatments out there right now. I like methylene blue. I use it at very high doses. You cannot use it with some antidepressants. You have to be very careful with it. The higher you go, a little more risk, but the more it does. I get that from Cribb's Pharmacy. It's very cheap. Clotrimazole, which is an antifungal, you cannot get it in the United States in a capsule, and we use that. And also rifampin to start, and then working our way up to 600 twice a day, and then rifabutin, which is has a long history in the AIDS community. And you would need an eye doctor to say you do not have uveitis in your eye, and I believe that's a reddening of the colored part, and clarithromycin. And Bartonella has a biofilm, and there are a number of biofilm busters I'm using that I've done a lot of research on for my biofilm textbook. One would be Oreganol by North American Herb and Spice, and then Cinnamol, same company, North American Herb and Spice, and those are loose. And I would buy Nature's Way marshmallow root capsules, open it up, pour out half, drop 8 drops in, close it up, have it with food. And the last one does come in little gel balls, oreganol. One thing Zhang showed at Hopkins, and he's a very gracious man, is that more is better. These are not identical kinds of products. And so I believe that's the final step when you're killing Bartonella. If you recall, the first part was stunning and preventing reproduction, and the very last step is killing biofilms. My belief is that what's behind the biofilm is doing less than other parts of the infection. I could be wrong, but that's what I'm thinking. And that's just a sample. There's many other options for treatment. Those are just a few. There are dozens being looked at and used.
Yeah, I've done a little bit of research into the biofilm situation myself, and I think some of the material I've read was enzymes, certain types of enzymes that help with biofilm, but busting
Well,
biofilm.
lumbrokinase is probably the best.
And say that again, Dr. Schaller, which one is that?
I apologize. Lumbrokinase, LUMBRO kinase. And I would get the brand that begins with a B. I always say it wrong, Baluco or Baluki, and I'm sure I'm making a fool out of myself. Better late than never.
I think, yeah, I know it's, I think it's BOULKE, something of that nature.
That's exactly right. Yeah.
Yep.
Leave it to a lawyer to spell it right. So some feel that it is definitely dissolving biofilms and feel it's much stronger than nattokinase or serrapeptidase. And they're very compelling, and I respect them. Other people say, well, it's being dissolved in your saliva, then all the bowel stool, then all of your blood, and then it finally, some gets to the biofilm, really? So I understand that point too. I do use it at times, but my feeling is I found in our research that the essential oils are vastly underused, are incredibly powerful, and the only limit on essential oils is your stomach. And you can always cushion your stomach with marshmallow root or aloe capsules or slippery elm, and always food.
One other thing, these other medications that we've noted earlier in our last few minutes, clotrimazole, rifampin, rifabutin, clarithromycin, is there a benefit to crossing the blood-brain barrier using IVs as opposed to pill forms of these drugs?
I go by symptoms. If you're in great danger, and I would use an example that Dr. Burrascano said that was very helpful to me, and I think he nailed it. I am not a fan of quinolones because of all the tendon damage and other damage I've seen. But he said, if someone's going blind, I'm going to use that quinolone. I'm not going to play around. So I think my feeling is the same way as an answer to your question. If orals are working, they're working, and I've had great success. If they're not working, I'll do whatever works. And no neurological problems are acceptable. That's not a cure. That's still a problem. So I would consider that in that case.
Mm-hmm. So consider IV forms of these medications. Does clotrimazole, rifampin, rifabutin, and clarithromycin, are they molecularly designed to cross the blood-brain barrier?
My experience clinically is they are getting to the infections in the brain.
They are, okay. Because I know that has been, or that could be a problem with some of the medications that are prescribed for these infections. And I know that there's been more work on liposomal formulations of some of these types of medications to put them into smaller molecular structures or somehow create some type of structure around them to make them easier for uptake into the brain and making them small enough to cross the blood-brain barrier. In layman's
Absolutely.
terms.
Well, liposomal is the rage. Right now, somebody's putting a liposomal coating on my car and on my toilet paper in the bathroom and my toilet seat. So liposomal is everywhere, but I do agree with you. I think it will allow useful drugs to be even more useful in the same way it's done that for glutathione and vitamin C and quercetin and other things you certainly know.
Okay, so let's bank on these new liposomal formulations. All right, so I think we've covered quite a bit of information in Lyme and
There's
Bartonella.
one last herb I wonder if I should mention on
Yeah,
Bartonella.
sure. Yes.
A number of years ago, I was happy to befriend Dr. Zhang, and Dr. Zhang was sent over from China to teach Americans Chinese herbal medicine. My understanding is he trained with 9 of the 12 top Chinese herbalists. So I really enjoyed meeting him a very long time ago. He's semi-retired now, but still seeing patients. So we met each other at iLads, and I started wanting to do research on his herbs. So one herb that he had proposed for Bartonella was called HH, Petunia, and I may be saying it wrong because I've never heard anybody say it, but we found that increasing the dose was more powerful. We were looking at slides of Bartonella, and we could see that when we doubled the dose of HH, more died. Now, the only thing I have found is I don't believe HH will cure Bartonella. I think he may believe that, and that's fine. You know, honorable people disagree, but I have the blood smears. So that is another option, particularly if you're finding you're sensitive to the other things we mentioned. It's gentler in terms of die-off. So it's another option. And again, that can be from the Yale Clinic, or sorry, the Zhang Clinic in New York City. And they'll have the HH, and I have no financial association. Just to be clear.
Okay, so that's good. So HH for Hutonia, and that could be another helpful herb for Bartonella.
Exactly. And I believe they may have changed it from they made it HH2 based on my research to make it more potent, but I'm not sure if they still are using that designation now.
Okay, all right, good to note. I mean, all of this information is informative for the audience, so I'm sure they will be running with it and asking their respective physicians about all of this juicy information. Well, so we've concluded our brief discussion on Lyme and Bartonella rage. This doesn't mean that though we won't present more information on this in the future, because there's so many aspects to this, but here we have just presented a short synopsis of some of the main points that we wanted to cover. And thank you, Dr. Schaller, for your input on this. And please stay tuned because we have more videos coming up. So thank you for this information, Dr. Schaller.
My honor, Valerie.